Hello and welcome to Pediatric Doctor at Home, a medical education channel from a board-certified pediatrician. Today's discussion is about falls in babies and children. As a parent or caregiver, it can be tough to witness the hard landing of a child, and it may be difficult to determine when a fall is harmless versus when it is a cause for concern. In this video, we will delve into what parents should watch for when falls happen, when medical attention is warranted, and strategies to prevent falls. Falls are a common occurrence and are a frequent cause of injuries in childhood, sending many to the emergency room each year, especially children under 5 years. Most falls happen at home. Babies can fall while being fed, changed, or carried. As infants and toddlers learn to roll over, crawl, walk, climb, and explore the environment, they can fall off furniture, stairs, even windows. Young children are naturally unsteady on their feet as their motor skills and sense of balance are still developing. So as they move around, stumbles and falls are bound to happen, especially as they test their physical limits. Most falls in this age group are trivial and typically are no cause for alarm. In fact, they are a useful part of a child's development, helping them improve their motor skills and understand the consequences of their actions. However, even though most falls in children are minor, sometimes serious injuries can occur and certain circumstances warrant closer attention. Parents and caregivers must be vigilant for signs that a fall might be more serious. If a child falls from a significant height, such as from a playground structure, an attic, or balcony, there is a bigger risk of injury. The higher the height, the greater the possibility of a significant injury. Even if the child appears unharmed, internal injuries can occur without obvious external signs. For infants, we worry about falls from more than a height of 3 to 5 feet, and for older children, falls from 3 times the height of the child. What to do if a child in your care falls? Do not panic. Stay calm and attempt to soothe the child. You may experience some guilt, but know that accidents do happen and it doesn't necessarily mean that you are a terrible parent or caregiver. Check for abnormalities like swelling, bleeding, deformities, and inability to move the arms or legs. Definitely seek medical care if there is a wound that continues to bleed despite applying pressure, or if it looks like a bone might be broken. A very important cause of concern, particularly in babies, is the risk of a head injury. Any fall that involves a blow to the head should always be taken seriously. Traumatic brain injuries can have delayed symptoms, so watch for the following signs which could be indicative of a cracked skull or bleeding into or around the brain requiring immediate medical attention. Loss of consciousness. It is okay for the child to be stunned for a second or two, but passing out for more than 5 seconds should not be taken lightly. Decreased alertness. This is when a child is not responding appropriately and not acting right. They may be agitated, irritable, crying continuously, confused, lethargic, unusually sleepy. If there is an obvious bump or swelling on the head, especially in babies less than 6 months, more so when these bumps are located on the sides of the head, the top or the back of the head rather than the forehead. Other worrisome signs for a head injury include leakage of fluid or blood from the nose or ears, persistent vomiting, seizures, severe or worsening headache in children old enough to speak. Very important to remember that when in doubt, it is always better to err on the side of caution. If you have a gut feeling that something is not right, don't ignore it. See a doctor. In the absence of the red flags mentioned above, you can do the following at home for a child after a fall. Give pain medicine as needed for comfort. Apply ice packs to the bumps for a few minutes. Naturally, the swelling starts to resolve in hours but may take a few days to disappear completely. Allow the child to sleep or rest. It is not necessary to wake up the child multiple times if there is nothing concerning for a head injury. Continue to observe the child though for up to 48 hours for any unusual behavior or new symptoms. When a child is taken to a medical facility, an evaluation will be performed and further tests may be done depending on the case. Pediatricians and emergency room doctors are well equipped to assess falls and determine if additional intervention is needed. Note that most children with minor injuries will not need a CAT scan of the brain. CAT scans come with exposure to radiation and should be avoided unless it is absolutely necessary. In terms of prevention, these are steps that parents and caregivers can take to reduce the risk of falls at home. Do not leave babies unattended. Supervise children closely. Use the safety straps in changing tables, infant seats, high chairs, strollers, and swings. Keep the sides of a crib up and fix guardrails on beds. Install safety gates at the top and bottom of stairs and make sure they are firmly attached to the wall. Keep doors to dangerous areas locked. Secure heavy furniture with anchors. Do not place furniture close to the windows. Install window guards. Teach children about safety and encourage them to play in age-appropriate environments. In conclusion, falls are a common aspect of growing up. While most are harmless, it is essential to recognize the signs of a potentially serious fall and act accordingly. By staying informed and vigilant, parents and caregivers can help ensure their child's safety. Thank you very much for listening, and don't forget to subscribe.